Today, the biggest threat to healthcare businesses is healthcare consumerism. But it's not just a threat, it's a dynamic megatrend. This megatrend and its 9 definitive drivers are being referred to as the new healthcare consumerism. The 9 drivers of healthcare consumerism are: Number 1. Self-diagnosis. WebMD, Drugs.com, and even traditional hospitals have begun to help healthcare consumers become as educated as possible about their health conditions without having to see the doctor. Number 2. Alternatives and substitutions. In 1990, 1/3 of all Americans had used some form of complementary and alternative medicine. By 2002, that number had more than doubled, and it continues to grow today. Number 3. Clean eating. Educated consumers are also increasingly aware of conditions of how the food they eat is grown and processed. The growth of clean eating may be the most obvious at the grocery store. Grocers now have full aisles filled with organics. Food is sourced as wild-caught as consumers have begun to believe that cleaner eating could lead to the decline of diseases and ailments, from cardiopulmonary to dementias and cancers. Number 4. Elite fitness and outdoor activity. Just as consumers are learning that more energy can be derived from cleaner eating, physical fitness leads to better circulation and vitality as Gen Xers and millennials age. Repair medicine will continue to rise, from orthopedics to neuromuscular and podiatry. Number 5. Medical shopping. The trend of self-diagnosing exploded in the mid-90s when the use of the internet exploded. A decade later, with the advent of smartphones, patients could look up the cost of their physician's prescriptions without even leaving the consultation. Consumers could easily compare the doctor's name-brand samples and search for cheaper, generic alternatives. Number 6. Amplification. Smartphones did more than merely provide immediate access to the internet. They also ushered in the amplification of just about everything, from GPS maps to ride-sharing to combating angry birds. Why should healthcare be any different? Fitbit, iPhone glucose meters, and real-time calorie counters do more than enable consumers to stay aware of their health. They gamify it for us. Number 7. Pricing transparency. Healthcare services were previously cloaked behind the shadow of big insurance companies, responsible for negotiating on price after the fact. But that's simply not how consumers think. When we're responsible for purchasing our healthcare, we want to know what something costs before we buy it. Number 8. Undoctoring. When a patient sees their doctor, they've already likely gotten their first and second opinion about their symptoms from online educational sites and from the collected wisdom of their social networks. Armed with more information, patients challenge doctors to explain more and won't simply follow doctors' orders without a good reason. Number 9. User experience. As insurance chaos has destabilized access and attitudes around healthcare, today's patients demand a much better user experience. Armed with more information, consumers have come to expect the Starbucks and Chick-fil-A world of speed and personalization. The user experience is rising as a key leverage point. Speed in the waiting room, accuracy and responsiveness of the website, live answers on the phone. All of these make up the user experience, and modifying a business to accommodate for these 9 drivers are what will help companies compete for healthcare consumers.